So basically, you can do Prolo or you can do stem cells. What are like mainstream medical solutions to this?
Go see your dentist.
Dentist.
Protect your teeth from grinding themselves out from the TMJD, but they actually make it worse because it changes the angle of how your mouth closes and you get more pain because the muscles can't close all the way, so they're spasming harder.
Welcome to the Longevity Unlocked podcast. We are your guide to optimizing your life one health tip at a time. We are not providing a replacement for medical advice. Please always consult your doctor before making any diet, exercise, medical, or lifestyle changes.
Ladies and gentlemen, welcome to Longevity Unlocked.
Most of our people, I think, listen and don't watch, so I don't think they're going to get that.
Oh, well, anyway, I did something goofy on camera, but it was basically me opening my mouth very wide to demonstrate the fact that we're going to talk about TMJ today. So TMJ, which Doc enlightened me last week. I thought TMJ was a disorder, and it's not. It's a joint.
Temporomandibular joint.
Yeah.
It's TMJD for disorder.
Yeah. I was way off base. I was out of pocket, as the Gen Zs say. So TMJ is literally just a joint, but having something wrong with your TMJ is a disorder, I guess. So
yes.
TMJD.
Yes.
Okay. Sounds like a crazy degree you get. Kyle Holbert, TMJD. Anyway, let's reel it back in. So what is TMJ problems? Where do they come from? What is the disorder? Can you enlighten us?
So temporomandibular joint disorder, give you a guess, it's a disorder of the joint. Here's a picture of what the joint looks like. And you see that disc kind of in the middle between your mandible and your maxilla? That disc is supposed to create smooth gliding as your mouth opens and closes. It hinges across that and glides open. When there's something wrong, either a muscle spasm, a ligament instability, or a direct injury to the disc, it doesn't glide smoothly. It pops, clicks, and doesn't fully open, creating pain.
So where does this come from? Like, how does your face just stop working?
That's a great question. A lot of things can feed into it. It could be from accidents. It could be trauma. It could be stress. It could be chronic something or other. It could be too small of a palate, something else random.
So there could be like 100 causes.
Yes.
Wow. Okay. So is there like a most common one?
In my opinion, a lot of it is because the neck is unstable. Because almost every person I talk to with TMJ, they have a pain in their neck. And so the neck and the jaw, while they don't directly hinge through the muscle groups, they hinge right here. And so when the neck's unstable and spasming and pulling, it's yanking on your jaw.
Gotcha. And you have some history with TMJ, don't you?
Yes. We've talked about this so many times, but
We'll
I messed up my neck. And the neck over years turned into jaw pain. It got to the point that I could only open my mouth about halfway without jaw pain. Pain right here chronically, like it hurt to touch, it hurt to rub. That's the reason I got into this field. I got stem cells in my jaw, stem cells in my neck, which 9 years later, the pain is still gone. So
fixed it.
Yep.
Amazing.
Mm-hmm.
Yeah. I remember I actually had some TMJ issues as well. When I was chelating, it just happened to me like, twice a year, just my jaw would lock up and I couldn't open my mouth. Mm-hmm. And it happened one time when I was in Doc's office. It was like a side quest. And you were like, I could fix that. And I was like, what? And you were like, yeah, I'll just fix it right now. And I was like, what do you mean you could fix that right now? And so we go back and he stabs me a bunch of times. And I was like, because I couldn't hardly open my mouth for a few days. And I think it was like 1 or 2 treatments. Mm-hmm. And it never came back. It's been 5 years.
You keep telling me. I don't remember doing this one on you.
You don't?
Nah.
It was like a life changer. And it was like a side quest.
Was this in the first office or the second?
No, it was like the OG.
The OG? That's before we were friends. We were just like this random patient that would like just appear sometimes and chelate and then like do a bunch of things and disappear.
Yeah. Yeah, it was wild because I was like, yeah, this thing happens to me. And you're like, I can fix that. We did it and it's been gone. Yeah. Forever.
Yep.
Never had an issue.
So what I did for you was I injected the joint, but then I also injected the muscles. So if you can get the muscles to rebalance, a lot of times the pain will go away. So we inject the masseters and the stylohyoid ligaments. And with that, it takes a lot of the spasm out of it and the jaw will start to bounce again. And once A big part of TMJ, why the jaw hinges to one side or the other, is one muscle's in spasm, the other side's not strong enough to balance it, so it kicks out to the side. So if you release the spasm, fix the weak one, and they balance, they'll open and close evenly.
So you always have to treat both sides.
Yes, always.
Okay. Makes sense because they move as one unit.
Mhm.
What do you treat it with?
My preference is stem cells. It's either prolotherapy or stem cells. We're not putting PRP in anyone's jaw ever. You might not be able to eat for 2 weeks. Stem cells is what I see the best results with, the placental tissue. Injected all throughout, the tissue acts as a graft, it heals, and great. Prolotherapy usually requires multiple rounds, and every time you do it, there is a couple days where you really can't open your mouth. It hurts.
Yeah.
But oftentimes, you have to let me treat your neck. If I'm treating just your jaw, it's kind of like the 2 episodes ago where we talked about the knee. If I'm treating your jaw, I'm treating oftentimes a symptom. If I don't treat your neck along with it, it will eventually come back.
Yeah. And for full disclosure, he treated my neck shortly thereafter.
Yep.
So probably it was the both that did it
Always.
and made it go away. We did a lot of injections in my neck.
Mm-hmm.
So basically you can do Prolo or you can do stem cells.
Mm-hmm.
What are like mainstream medical solutions to this?
Go see your dentist.
Dentist.
They'll
What's
give
the
you a
dentist?
bite guard so that you stop grinding at night, and that's it. The problem with neck guards, yes, they'll make your teeth, or they'll protect your teeth from grinding themselves out from the TMJD, but they actually make it worse because it changes the angle of how your mouth closes, and you get more pain because the muscles can't close all the way, so they're spasming harder.
So it's like a Band-Aid.
Yeah.
Okay. So are there any other like decent ways to approach this?
In theory, if you have sleep apnea, correcting the sleep apnea will help. Our podcast producer is telling us about a TMJ massager. But again, you're treating symptoms at that point. You're not treating the problem.
Yeah, that makes sense. Okay, so I do want to talk about pricing a little bit. We, I think, have made this as streamlined as simple as possible. $499 for Prolo. Bilateral. So doc will treat the whole jaw, $499 with Prolo. Stem cells, $4,999.
Whatever he said.
Yep. We went back and forth on this, and doc has cut margin once again for the millionth time against his business guy's advice, just to help people with this, because it's such a thing that like it's so life impacting. Like when you can't open your mouth and your whole face hurts, like you can't even think about anything else.
Yeah.
You're like, my face hurts. That's all you can think about. My freaking face.
Fair enough.
I want to talk about pricing a little bit more often on the podcast too, because like we don't just want to say, hey, this is the things you could do, but this is also like what we think it should cost based on fair and low to fair margins. So like if you're asking your regenerative medicine doctor, wherever they might be, about this, now you have a reference point to go off of.
Yep.
Anything else you want to add about TMJ?
You can't crack your jaw. Like your chiropractor cannot fix your TMJ by cracking your jaw into place. You'll be back like 3 days later because it's a muscle spasm. At the end of the day, its muscles aren't firing properly. So you can't crack your jaw. You can't massage your jaw. You can't bite guard your jaw out of having TMJD. It's just nothing.
Makes sense. You did do an adjustment on my jaw after my injections.
Yeah, I balanced the muscles. I did a little craniosacral, balance the muscles, just basically make the injection part not suck so much from the spasm, but...
Okay. Yeah, you can't just like pop it back in because there's a reason it went out in the first place.
Yep.
Makes sense. Well, ladies and gentlemen, thank you for joining us on Longevity Unlocked. Today we're unlocking jaws, not just longevity. I'm Coach Kyle.
I'm Dr. K. We'll see you guys next time.
This podcast is not medical advice, and any information taken from this episode should be discussed with your medical provider and not be a replacement for a consultation. We disclaim any responsibility for any possible adverse effects from information taken from the episode.